Me fumble them. This not time for we listen to the master sabi people them. Dr. Mafudia and Nurse Inez Kaye. Now this program well body na gently.
Good afternoon, everybody.
Good afternoon and good evening, everybody. Depending on who's on a day, on a good afternoon or good evening. This now is second program, Well Body na Gently. This month we dey focus on heart disease. Today, Dr. Soare, what do you get for teachery about heart disease?
Good afternoon, good evening, me people. And thank you so much for me on join we again this Saturday. We want to can talk about heart disease. Very important topic for me. We learn about heart disease. Now big topic. Now one way be say we can talk for days and days. We're not going to even cover about cutting them. But just some few basic things the way I want for me we talk about today. For my people to understand the basic problem, then way we call heart disease, and and get some knowledge where be say if somebody they get heart attack, they hopefully go able for recognize for say this na heart attack, and they go able for act quick and save that person day in life. But before we even begin talk about waiting exactly in a heart disease, I just want we get a understanding of how big this problem has to be. When I know for say heart disease, now the number one thing that the way they kill people then all over now the world today, the number one reason that the way people that they die, almost 7 million people then they die around the world every year from heart problem there. That's a big number than the way, see we in a Salone about 7 million people then in a Salone. So imagine the entire population at Salone, they die from heart, problem every year. Inside America, within America now, they say every 40 seconds, one person they get heart attack. So inside, this same way they talk, so like 2 people they don't get heart attack during that same day.
Wow. But that's not the Western world, right? What about Africa or Sierra Leone?
Well, like I say, 7 million people around the world, they die from heart disease. Guess what? Most of them people and the way they die now from third world country, then from Africa and other poor country then. Now then they die from them sick then they. So this also, problem we be saying at the Western world then normal. Then get Amboku, but we people then they die from even past the one the way they at the Western world. Inside Salone, we own Salone. We think say 14% of people the way they die now from heart problem then, some kind of heart problem then. So if you count 100 people that way die, 14 of them people and they na heart problem 9 kill them. That's a boku number for a small country. And a heart, disease, we think say na the number 5 reason that the way they kill people there. And stroke way in causing to heart attack, na the number 7 reason that the way people then they die. So, more just I want just into now waiting, the detail and what they can't talk about. Mr. Mohammed, if you can go back na the slide for him. We'll talk about, the heart waiting, how exactly the heart they work. And then we will talk about heart attack itself, waiting down the time, like waiting the cause, and then we will talk about how for prevent that day. So the next part we'll go talk about now, about how the heart itself they work. So this is a picture where for sure no more kind of how the heart sit down inside the body and all the connection there. The heart's not like pump. And so if you imagine like Guma Dam where they pump water go, Bokusa in a Salone, the heart's not pump where they pump blood all over the motor mind body, including the heart in your muscle. So the heart's not muscle line, God take maker. That muscle itself it needs supply of blood so that the pump will work fine. So now one grain heart in this body, so God puts in our body. That heart they get 4 parts then call them chamber then. 2 at the top, 2 at the bottom, where now they control the flow of the blood inside the heart, come on at the heart. Where the blood come on, at the heart, we got all them pipe there where then called blood vessel then. Now then they transmit that blood, then now the blood they flow for me it go through the different parts of the body. So as blood they come inside the heart, now so blood also they go through from the heart to other parts of the body. The heart it need electricity. So just like Guma, you need electricity for me that machine then I go my pump the water. The heart self you get electricity where it work with inside for allow the heart for pump through the body. And when you look at the heart, every time where it beats, it send blood throughout boku vessel there. Then expert then science then tell for say all them blood vessels in the body, if you line them up, head to toe, now over 100,000 miles of pipe then. And this whole human body also gets where the heart they send blood through. So this na big work way this heart also they do for we.
Wow. So the heart na a wonderful creation where God make, where it look like say we life. Now that heart they na in get some because na in the supply all sign of the body.
Exactly. So today we will talk about the problem then where they affect that muscle, that heart muscle, the way they affect that blood vessel and they inside it, where go make the heart not able for do the work where it's supposed to do. Now them problem they will they talk about coronary heart disease or people that know heart attack, all that is the same problem. Then at down the now they can focus on today by this talk here so. But for allow we for focus by the talk, Mr. Mohammed, if you can do me a favor, just pull this slide first because I want to see Miss Inez in face so they can talk this next part here so. For talk about heart attack, the big talk and an important talk. And one more we share this talk here so more we use true story. Now we can use for begin for explain how this heart problem here so be. So Miss Inez, I dey put on you on.
Yes, I'm Dr. Mafudia. Well, like how you say, true story, they go a long way. Me now one particular person, we don't get heart attack. I remember 2012, I've been 36 years old. And I've been just born, my last speaking, 2 weeks after I born him. I then a kitchen, the fry planting. Now I begin get this pain na my chest. And it been there right down here so na my chest. I they get the pain, and the pain begin they go all the way up this me arm. They come towards the back of my shoulder. Now pain where it's like something sit down on my chest. So na pain where I know say I don't ever get that kind of pain there before. Then I be make afraid. Because of that pain they were begin they get. And the kind where it begin they press na my chest. I say no, something wrong na here. Because I begin to lose me way for catch me breath. I begin get short of breath. Now I go dial 911 way inside America na we emergency dandy. I dial 911, then I knock na me neighbor in the mouth for making go help me because I been get young baby na an.
Then a serious situation than the way you go find yourself in that situation there. And you know what, you act quick, you get somebody for can watch the picking and call emergency. And I sure say now because of that quick action, they make you they let today for even can't tell we about this story also. So just for help people there, if you ever find yourself, God forbid, now Miss Inez in situation where you get that kind, that kind of pain there, now classic symptom than the classic pain where in a heart attack pain. If you find yourself in that situation, if you get aspirin and you use, go take that aspirin, the quick may you take them. So the dose we can recommend now around 325 milligrams. So, where they buy aspirin, so they're different one. If you get that, what they call now America baby aspirin or low dose aspirin, then a small dose then. So you go take 4 of them tablets then they. If na regular aspirin you get, you go take 1 or 2 of them day. You do that day, it go help for save your life and buy you time so that you go by the time you go to hospital, doctor they go able for help you. The next thing now for that quick for make you go able for go to hospital quick one. If you then are overseas country for call you emergency service, also the time this for say, maybe now something else, wait tomorrow, I'll go call me GP, I'll go wait till tomorrow. Immediately you need for act. call emergency. If you didn't America, you call 911 like waiting Miss Inez do. Other country then get the emergency number. May you go to hospital. And when you call, you need for tell them for say you think say a heart attack. Because when you tell them that they know the right people then where they go send come for bring on the right equipment then so that they go give you what you need and they were able for start for treat you right away even before you reach now hospital. And if you're not heart patient, where you don't get this kind of problem, usually the heart patients they get nitroglycerin when a special medicine for heart, for them condition. Yeah. So if you're not heart patient, you begin get this pain, you take your nitroglycerin 110 and call the emergency number. But if you there Salone, 911 no day, but ambulance then day. Now I don't know how much they're able to do for you now the ambulance, but if ambulance able can you go to hospital quick, then call ambulance, may you go to hospital. The important thing now for me you go to hospital quick. And when you go to hospital, you need for make them know for say you think say you they get heart attack.